You probably do not think of your body as a fortress, but in some ways it resembles one. Certain parts and systems in your body, like your skin, serve as barriers to guard you against communicable diseases. Your next line of defense is your immune system, which is constantly at work. Your body's defenders include your skin, mucous membranes, tears, saliva, perspiration, and stomach acids. Any pathogens that get past these barriers must face your immune system. So first, your skin. Unbroken skin acts as a barrier against pathogens, preventing them from entering the body. When you bathe, you remove pathogens and dead skin cells, leaving only new, healthy skin. Mucous membranes. The mucous membranes are the tissues that line your nose, mouth, and throat and produce a fluid called mucus that traps pathogens. Mucus from the nose and throat collects in the throat and combines with saliva to trap and destroy pathogens. Tears, saliva, and perspiration. These three body fluids contain chemicals that kill pathogens. Tears and saliva can destroy some pathogens that enter your mouth or eyes. Perspiration can combat pathogens on the skin. Stomach acids. If pathogens enter your mouth, saliva will destroy some of them. Those that you swallow will enter your stomach, where stomach acid will attack them. Your immune system is a complex network of cells and organs throughout your body that combats disease. Its job is to identify and destroy foreign substances in your body. Taking care of your immune system will protect you against many diseases. How the immune system works. One of the tools your immune system uses to fight an infection is its ability to run a fever. A fever is a body temperature that is above the normal level of 98.6 degrees Fahrenheit. Many pathogens cannot live at higher temperatures. As a result, an increase of 1 or 2 degrees in body temperature can destroy them. Your immune system makes use of a set of specialized types of cells in your bloodstream. T cells are white blood cells that regulate the action of the immune system. Phagocytes are white blood cells that ingest and kill pathogens. B cells are cells that produce antibodies. Antibodies are proteins that help fight infection. Active immunity. Antibodies can also give you immunity against further infection. Immunity is resistance to disease. Active immunity is resistance to disease that results from the body's production of antibodies. If you have a communicable disease, your immune system will produce antibodies to fight the disease. After you recover, the antibodies remain in your body, continuing to guard against the pathogens that cause a disease. You can also gain active immunity from a vaccine. A vaccine is a mixture of dead or weakened pathogens that is injected into the body to cause the immune system to produce antibodies. Passive immunity. You can also gain a short-term resistance to a disease by having antibodies from someone else's blood introduced into your bloodstream. This type of immunity, called passive immunity, can protect you if you are facing an immediate risk of developing a communicable disease. Communicable diseases vary in their symptoms, diagnosis, and treatment. As you know, a symptom is a change in body function or behavior from the usual. Diagnosis is the process of determining what type of illness is present by examining someone, studying his or her symptoms, and running tests. The treatment of communicable diseases may involve rest, fluids, and drugs, including antibiotics. Recall that an antibiotic is a substance that kills or slows the growth of bacteria. These drugs are appropriate only for diseases caused by bacteria and should be used as prescribed by a physician. Knowing and following responsible behaviors help protect you and others from infection. How many precautions on the following list sound familiar to you? Wash your hands frequently. Do not touch sores on your body. Use antibiotics only when necessary. Cover sneezes and coughs with a tissue. Do not share personal items. Do not share needles used for body piercing or tattoos. Keep insects and other animals away from food. Keep your fingers and hands away from your nose, eyes, and mouth. How many times have you heard that being said? And get the appropriate vaccines, especially during the winter season when it is flu season.